Hi, today I'll be talking about chondroitin sulfate. It is the major glycosaminoglycan found in cartilage. Chondroitin 4-sulfate contains D-glucuronate and N-acetyl-D-galactosamine 4-sulfate, whereas chondroitin 6-sulfate is instead sulfated on the carbon-6 atom of its galactosamine residue. It is a protoglycan. The bristles consist of a core protein to which chondroitin sulfate is covalently bonded, and the interaction between the core protein and hyaluronic acid is stabilized by a link protein as shown. Chondroitin sulfate promotes water retention and elasticity in the cartilage. This ensures adequate shock absorption and nourishment of the tissues lining the joint. On a side note, glucosamine is an amino sugar with which chondroitin sulfate is often combined. For example, this particular dog food contains glucosamine hydrochloride in combination with chondroitin sulfate. Here, chondroitin sulfate may inhibit the production of inflammatory mediators, giving it a mild anti-inflammatory effect. You can buy glucosamine and chondroitin sulfate separately, but they are often sold together as a single supplement. Chondroitin sulfate is extracted from animal cartilage, such as bovine and shark cartilage. However, shark cartilage supplements are not recommended, as they possess no distinct advantage over bovine cartilage, and they pose a significant threat to the integrity of the world's oceans. As for its uses, chondroitin sulfate is used as a dietary supplement to treat osteoarthritis. Chondroitin sulfate is beneficial in the treatment of osteoarthritis as it protects cells called chondrocytes, which help maintain the structure of cartilage. Through treatment with chondroitin sulfate, animals with osteoarthritis may experience significant pain reduction, allowing improved mobility in the osteoarthritic limbs. This in turn leads to the ability to exercise, thereby improving the strength of these animals. It is also used to replenish the glycosaminoglycan layer that normally protects mucosal surfaces, such as the intestinal tract and bladder, and it is administered in injectable form to treat degenerative disc disease. Chondroitin sulfate is commonly being used to treat cats, dogs, and horses. It is likely safe, with the risk of adverse side effects being extremely low. To date, no adverse effects on glucose regulation in diabetic patients have been recorded, despite the glucose content of chondroitin sulfate. It interacts with warfarin, an anticoagulant drug. Studies have shown that chondroitin sulfate enhances the effects of warfarin on blood clotting, which can cause bruising and serious bleeding. Lastly, research done on chondroitin sulfate has shown that some animals may appreciably benefit from chondroitin sulfate and others not at all. But given its potential for benefit and extremely low risk of any adverse side effects, supplementation is always recommended for animals with joint pain. Where a benefit is seen, doses of more expensive and potentially deleterious drugs may be reduced, such as NSAIDs or non-steroidal anti-inflammatory drugs. These include aspirin, carprofen, and meloxicam. As chondroitin sulfate protects mucosal barriers, it may not only enhance pain relief in animals administered with NSAIDs, but also protect their intestinal tracts from ulcerations, which are occasionally seen as a side effect of NSAID use. For this reason, chondroitin sulfate is used as an alternative to treat osteoarthritis in animals unable to tolerate the adverse effects of NSAIDs, or as an add-on therapy.